Good morning,
Good morning.
everyone. Today's webinar will be presented by Josephine Araki, and she'll be covering the Hawaii VFC program re-enrollment. Next slide, please. So just a few housekeeping items before we get started. Please mute yourself when you're not speaking. And please note that today's session will be recorded.
Oh, Jennifer, we can't hear you anymore. Since we can't hear Jennifer, at least I can't hear Jennifer. Today's session is being recorded. The slides and the webinar will be uploaded to our DOH website. And if you wanted to be added to the Hawaii VFC program email list, please email your request to the Hawaii VFC at doh.hawaii.gov. And in the subject line of the email, please write email list. Sorry, Jennifer. Jennifer, did you want to do the next slide? During today's webinar, please use the chat to ask your questions so that our subject matter experts can respond directly. We'll be answering your questions at the end of the presentation. And as Jennifer mentioned, my name is Josephine. I'm one of the quality assurance assessors, team lead. So the objectives for our presentation today is that you should be able to review annual VFC re-enrollment process and requirements for 2024. And we're also going to review the Hawaii Immunization Registry annual requirements for 2024, and also understand digital data logger requirements and identify CDC educational training resources. I did also want to mention about temperature logs. If we do request that you submit temperature logs for any unit that is housing VFC vaccine. So for VFC re-enrollment, it is a federal requirement to remain enrolled in the VFC program so that you can continue to receive the subsidized vaccines. We did launch our re-enrollment for next year on November 15. You should have received an email as well as receive a packet in the mail. If you have not, please email hawaiivfc@doh.hawaii.gov and we'll get it out to you. Re-enrollment allows providers to renew your participation in the VFC program. With that, you can update your information, you complete the online training so that you are up to date with what is the requirements, updating provider profiles, and you are agreeing to the program's federal requirements for participation as stated in the provider agreement. Regarding the VFC provider agreement, it must be completed annually and it must be signed by a practitioner that has prescriptive authority in Hawaii. It can be an MD, a DO, or an NP with prescriptive authority, and it must list a primary and a backup vaccine coordinator. We've been receiving some provider agreements that only list a primary, but a backup is also required. And if you have any changes to your delivery address, phone number, your vaccine delivery times, or any of your coordinators and medical director, it should be reported to the Hawaii VFC program. We'll send you out a form, you complete it and send it back to us. I did want to mention that for delivery times in our neighbor islands, because of the time that it is required to ship, for neighbor islands, we request that your delivery times be either Wednesday, Thursday, or Friday. Monday or Tuesdays are not options for neighbor islands because of the delivery time of the vaccine. For re-enrollment requirements regarding the vaccine management plan, we do require a completed vaccine management plan. I highly recommend that you utilize our template as it meets the Hawaii VFC and CDC requirements. And it is not deemed complete unless it is signed and dated by either the primary or backup coordinator or the medical director. Re-enrollment requirements for education. The primary and backup vaccine coordinators are required to complete You Call the Shots Module 10, which is on storage and handling, and You Call the Shots Module 16, which covers the Vaccines for Children program. So regarding re-enrollment, if your certificates are current, within 1 year of completion date, you can submit your current certificate. So for example, you did your modules last year, December 30th, and you submit your re-enrollment documents tomorrow, December 20th, you can use your current certificates. But if you submit your re-enrollment documents on 12/31 or later, you would need to complete the training again and submit your new certificates. So we do allow that time. And I believe that those two modules will be updated for 2024. Now, to access the modules, currently, if you are going to complete your do your modules before December 31st, you would go to the CDC Training and Continuing Education website, or TCEO. So after completing a course, you would log on and either log in or create a new account on TCEO at this website, www.cdc.gov/getCE. Then you would visit search courses to find the course, and the course numbers would be as listed here, WB4626 and WB4627. Scroll down and click on the title of the course, review the information on the course summary page, and then you'll just click to continue. If prompted, then you would enter the course code or verification code in the course access code box. Because you're doing those two particular courses, I don't think that you need the course access code. That's only if you're attending one of their online webinars. If you choose a type of continuing education you'd like to earn, you can select more than one. And then under pending CE on the My Activities page, you would click on the course evaluation and complete it. And then when that is done, you'll be able to go and get your certificates. I'm not going to go over actually going to the website and doing that, because after December 31st, CDC is switching from their TCEO to CDC Train. Beginning January 1st, 2024, new activities that offer CE from CDC will be listed in the CDC Train website. So if you plan on redoing your modules 10 and 16 for 2024, once they've been changed, you'll need to go to the CDC Train website. If you don't already have a Train account, please create one. And I have the website listed here at for www.train.org/tutorials for more information on how to access their website. You can still access and download your CE transcripts and certificates in TCEO until the end of 2025. When should you use CDC Train? For all modules courses that will be completed on or after January 1st, 2024. For VFC re-enrollment, it is due by January 31st. New providers that enrolled prior to December 2023 will also be expected to complete 2024 VFC re-enrollment. So say you enrolled as a new provider in October or November or even December of this year, you will still need to complete re-enrollment. And that is because new vaccines were added to the VFC program, the COVID-19 vaccine and RSV vaccines. What's going to happen if you don't complete your re-enrollment? Your account will be suspended, and when you're in the suspended status, you won't be able to submit a vaccine order or even transfer vaccines between provider locations. Say your location has a sister location, you wouldn't be able to transfer vaccines between your locations. After several reminders, if you have not re-enrolled by January 31st, 2024, we will disenroll you from the program. And if you wish to re-enroll, you'll have to start the process again. Hawaii Immunization Registry re-enrollment. I'm not a specialist in HIR, but according to HIR, you do need to complete the annual facility agreement as well as the confidentiality and security statement. The annual facility agreement is per location. The confidentiality and security statement is per user. So if your location has more than one user, each person would need to complete the confidentiality and security statement. And if your enrollment is not completed by January 31st, 2024, your HIR access will be disabled. So though it is not a requirement for VFC re-enrollment, if you don't complete their the HIR re-enrollment, you wouldn't be able to place any orders, as all orders are going to be online and online for other than flu and COVID vaccines. If you have any questions, HIR contact info is registryhelp@doh.hawaii.gov, and their phone number is 808-586-4665. And if you live on the neighbor islands, it's 1-888-447-1023, as well as their fax number. I believe the annual facility agreement is online, but the confidentiality and security statement is still a paper form that you would need to send to them. You can either email it to them or fax it to them. So HIR online facility agreement. It used to be a hard copy, but now you can complete it online in HIR via the HIR user interface, and it'll automatically update your location's enrollment and contact info. And as I mentioned before, the CSS form for user account access is not part of this online feature. The annual enrollment period is between November 15 to January 31st. They're not going to accept any more hard copies of the provider enrollment forms. And after January 31st, if a provider doesn't update their online facility agreement, all users who have an HIR account linked to that location, they'll no longer be able to access the system. The account will be disabled. So it is very important to complete your online facility agreement. Electronic data submissions via web services sent directly to the HIR will not be affected. Only new providers will continue to use the hard copy process for initial enrollment. So who will be affected? All active providers currently registered and have an org in HIR will be affected. There will be a prompt telling you to update your facility agreement online. And as mentioned, it's if you need assistance, it's the same information, registryhelp@doh.hawaii.gov, and the phone numbers. So the HIR online facility agreement instructions, note after January 31st, if the facility's primary POC, the physician or clinic administrator has not completed the online facility agreement, all users will have their accounts disabled. But it does not impact electronic submissions to HIR. So if you are the primary point of contact POC for your org, you'll need to log on to HIR, and this is the message that will pop up. Our records show your organization has not submitted its facility enrollment form for the upcoming year. You'll be able to access the HIR during the enrollment period, but not after January 31st if you haven't completed that process. So only the physician or facility clinic administrator can complete the annual enrollment form. So you're going to review the online form and check that all the entries are correct and completed. This is what it's going to look like. You see your clinic, your organization name, and you just need to make sure all of the sections are complete and accurate. If you're not the primary point of contact, don't click OK. It needs to be the primary POC for the facility that needs to complete the form. So that is, if covers HIR. I'm not too familiar with HIR, so please contact them if you have any questions for that. Take note, for the purposes of the VFC program, the term vaccine is defined as any FDA authorized or licensed ACIP recommended product for which ACIP approves a VFC resolution for inclusion in the VFC program. We mentioned that because the RSV is a monoclonal antibody, so that is also included under the term vaccine. Primary and backup vaccine coordinators must complete the annual You Call the Shots modules. As a location, you are required to offer all ACIP recommended immunizations based on your provider profile. So if you are a specialty location, you would just need to offer what is within your specialty. And that would be like a birthing hospital, or with Maui Job Corps, you are one as well. The VFC program is a federal entitlement program in which the VFC eligible patient is entitled to receive all ACIP recommended immunizations. With the addition of new immunizations into the program, remember to offer all age appropriate immunizations for your patients. Example of the immunizations for all age groups that your practice must be ordering is the COVID-19 vaccine for 6 months and up, and the flu vaccine. We do say that the VFC does say that you must carry all vaccines, but for us, as long as you offer it and be able to order it, we're fine with that. Even after completing 2024 re-enrollment, providers who have not ordered routine immunizations in the past year, so if you re-enroll but you don't order vaccines, you're going to be disenrolled from the Hawaii VFC program. We wanted to make note on digital data loggers. As we've been doing our site visits, we've noticed that locations have had more than one digital data logger in their unit. We verified with the CDC that there should be only one DDL per storage unit to prevent confusion. If one unit is showing an excursion and the other is not, we wouldn't know which one to follow. But if you do have multiple DDLs in your unit, you would still need to report all temperature excursions. So from both units, if one is not showing and the other one is, you would still need to report the one that is showing the excursion. And all of the DDLs that are used in the storage unit must have current certificates of calibration. We've noticed that as they are expiring or expired, they don't read accurately, and that sometimes is when you'll notice temperature excursions. And you must also have backup DDLs for each VFC storage unit with current certificates of calibration. We do offer the Berlinger digital data logger. So if you do need some, if you notice that your certificates of calibration are expired or will be expiring, please contact us and we can have some sent out to you. Our contact info, again, we have for HIR the same information as I'd mentioned before. And if you have any VFC related questions or concerns, please feel free to contact any member of our VFC QA team, and that is our contact info there. We do have more people now with our quality assurance team. There are 5 of us instead of previously there was just 1, so please feel free. We ask that if you email us directly, please CC all of us. If one of us can't answer, maybe someone else will be able to answer. And we also have Heather on there as well. Does anyone have any questions? Please feel free to ask your questions now or type them in the chat box. No questions?
It's Marita. I do have one. I was just kind of looking at the letter for the annual enrollment. And so do you need for us to fax in the certificates as well as the VFC management plan? Do you need all of that stuff, or just that we've done it?
The certificates, no, we do need copies of your certificates for the You Call the Shots modules. Is that what you're referring to?
Yeah.
Yes, we do. request that you submit that as well.
Okay, okay, thank you.
Thank you for that question. The DDL certificates, we don't require you to send to us, but the You Call the Shots module certificates, we do.
Okay, and as well as the vaccine management plan.
Yes, and
Okay.
that is different. That is new this year. We've added the request for the vaccine management plan, as well as the You Call the Shots, only because we've noticed that providers will sometimes forget to update them, and they'll have had a change in the coordinators.
Okay, okay, thank you.
Yeah, of course. Does anyone else have any questions?
Hi, Josephine. I have a question. Is it required that all like RNs who give shots need to enroll in HIR?
Not necessarily. It would be whoever will be the one that's doing your vaccine ordering or monitoring your HIR that would need to have an HIR account. It would be beneficial for them to have one, but it's not required.
Okay, thank you.
Thank you for that question. That's a good question. Does anyone else have any other questions? If not, that'll be the end for our presentation today, but we will be available until 10 a.m. through Teams if you guys you leave and you think about other questions later. Elohi is typing something. Oh yes, I forgot about that. For our post-webinar survey, please use the following link to complete the satisfaction survey. In the survey, we ask that you tell us other topics you want us to talk about, if you have a preferred date or time, how we can improve, we would really appreciate it. Thank you guys. Yes, happy holidays, Merry Christmas, and Happy New Year to you. Thank you.